I'll second that.
First item on the agenda is 21 Ashcroft Terrace, 2 variance requests. You want to run through them, Rosemary?
Yep.
Go ahead.
Oh, Jim.
For the record, I'm Jim Scanlon here on behalf of Anita Wright and Dorothy DiChiara. At 21 Ashcroft Terrace, it's an existing 3-bedroom dwelling. We have the existing system shown in red, the septic tank, and the approximate location of the leaching field. We're proposing to put in a new septic tank with a pump chamber and a leaching field, 72 by 14 and a quarter, utilizing Presby Enviroseptic pipes. We have 4 lines, again, 70 feet each. It is a 3-bedroom. We have designed the system on Title V as opposed to Groveland regulations, and that's one of the variances that we're asking for is from the Town of Groveland Regulation R1 2.3 Section 8, which requires 150 gallons per bedroom, and we're proposing 110 gallons per bedroom for the design, which is Title V. And that's primarily due to space. We're 11 feet off the dwelling, 10 feet off the property line in the back and in the front. I'm sorry, in the back and on the side. The second variance that we're asking for is a reduction to groundwater. Again, it's a Presby Enviroseptic pipe. The state allows a 2-foot reduction to groundwater, and we are requesting that. I would open up to any questions that you might have.
Are you done out there?
Do you have any concerns, or? I'm okay with it.
I'm okay with it. I'll second that.
Yeah, the only, I had asked Jim for just one thing to change, and so he just gave me the plans tonight, so, but we had already talked about it, so I have no problem. So we're all set.
Okay. Do I have a motion to approve the 2 variances?
I make a motion to approve the 2 variances.
Do I have a second?
at 21 Ashcroft Terrace.
Aye.
All in favor?
Aye.
Aye.
Motion passes 3-0.
Good to see you, Jim.
Oh, we've got one more.
One more.
There is no soil.
to see you, too.
No town soil out there,
Still
right?
good to see you.
No town soil out there, right?
No, unfortunately, there is no town sewer out that way.
All right, again, for the record, I'm Jim Scanlon, here on behalf of Robert Sherburne, 267 School Street. We have a 3-bedroom dwelling with an existing system. There's a septic tank here, shown in red, and a leaching field, shown right here. We are proposing to put in a new septic tank with a distribution box, and then again, a leaching field utilizing the Presby Enviroseptic pipes. The variance that we're asking for is from local regulation B310B, which requires a 100-foot setback between the soil absorption system and the wetlands. There are wetlands on the other side of School Street. We are 77 feet from the edge of the wetlands to the edge of the system. There is some soil replacement, so a 3-foot soil replacement, so we're about 74 feet from that. This is the existing system, and as you go this way, you run into ledge. That's why we picked that location for the system. Again, the only variance is the setback to wetlands. We're more than 50, which is the state requirement, not quite 100, and we have gone before the Conservation Commission, and they approved it.
No concerns, Rosemary? No?
No, I've reviewed it and been over everything with Jim, and everything is fine.
Have a motion to approve the variance?
Second that.
Do I have a motion?
I'll make
A motion to approve the variance at 267.
Now you'll second it?
Yes, sir, Dave.
All in favor?
Aye.
Aye.
Motion passes 3-0.
Thank you very much.
Thank you.
Good to see you.
Has everybody had a chance to read the minutes from April 18th?
Yeah, they look good.
You bet.
Take care.
Oh, yeah.
I know Jim was not here, so you read them.
I read them, everything looks good. Make a motion to approve the minutes from last meeting.
I'll second that.
I wasn't here, so I can't help you.
Yep. So, all in favor?
Aye.
Aye. Motion passes 2-0. Next up is the health agent update.
So, since our last meeting, I've been out doing soil testing. We had 6 installations of septic systems, plus I started doing the food inspections and tobacco. We finished up the 4 tobacco licenses, and did the inspections there, plus food inspections.
Just about done.
Yeah, we have, I completed 2 pool inspections, plus reviewing of septic plans that had come in. And then there's been just an overwhelming amount of meetings lately with the PHE grant and everything. And then plus, I had 2 webinars, one on Maven and one on the health advocacy. That was
Thank
just
you.
the other day, so
All you do.
that's what I've been up to for the last, since the last meeting. If anybody has any questions?
Do we have contact for the owner and Nyrod's, New Rods? I would like to reach back out to her and let her
Okay.
know that the decision to go to $100 on the tobacco fee was not your decision, it was a board decision. So
I know, I saw that.
if you can send me her email or contact number or something, I would like to reach out to her.
No, she did pay, but she did submit the fact that it's now gone up to $100, so,
Yep.
yeah. But I haven't, the others have not said anything about going up the $100, and then plus a lot of the food establishments, we went up as well, and I haven't really had anybody complaining about that, so.
I think the fees in town have been what they have been for many, many, many years, so going up to what we've gone up to, I don't think is unreasonable personally.
Right, I mean, everything, yeah, all the other ones went up. Yeah, so I don't think they went up that much, and so, but that's the only complaint that we have received. And when I go out to do the food inspections, nobody has said anything to me, so as far as, that theirs went up as well, so. So I think everything else is okay, so.
Yeah, if you don't mind sending me her contact information, email or phone number or something, I'll reach
I
out
will.
to her.
Okay. Yep.
And then the new place down in the square there?
Unfortunately, it's, the last I knew, it was still being placarded.
Okay.
I have not heard from Sam that it's been reversed. I did have somebody come in and request the food application, and I told him that I couldn't give him a food application until he submitted a plan to show me what exactly is going in there. And I still, that's the 4th time I've asked for one, and I still have not received it.
From the same owner or the same applicant?
Same people, yep. So I asked Sam, because he gets a different plan than what I get. So I need to see where everything is laid out. I need the dishwasher, the 3-bay. I need to know how many hand sinks are going in, what they're using for the floor, as you know, and walls and everything else. And I haven't seen anything come in and how they're setting all of their stuff up. So I told them that, if you've already submitted things and already put in your plumbing, you may be adding another hand sink or something. It's not within the area that I need it to be in.
Yep.
So, but I still have not received it, so I'm still waiting. But I have not heard anything different as far as whether or not that Sam has released it or not, or given them their building permit.
Okay. Keep us posted.
Sorry they're making that difficult.
Yeah, it's too bad.
Anything else?
That's all I have, so it's just been busy because we have all the foods expire June 30th, and then plus the tobacco, and then plus the pools, so we've been trying to get everything out to everybody, and
In
Lar-
addition to septic systems.
Yeah, so Laurie's been, getting out all of their permits out to them, and so I dropped off one of the tobaccos today, because we hadn't heard from him, so if we haven't heard from anybody, we've been trying to follow up by either paying them a visit or something, just to make sure that everybody has gotten their permits. I think we still have a few more that we're still trying to follow up with, so, but other than that, yeah, there's been, but this is typically, May and June is typically the busy times for us anyway, so.
We charge late fees if people don't apply on time?
No, we have no late fees.
We should.
In your packets, Laurie put together the amount of money that we've been pulling in, so you can see that it's been pretty busy, that the money that we've brought in for between septic, food permits, tobacco permits, and
Septic going on.
so, yeah, so you have that in your packets there, that how much we've been taking in for May and June.
Okay. We should consider a late fee if people aren't applying on time.
We're trying to do having on the applications, have them give us an email, so that we thought that this would be helpful, that we could send out their permits, to them with an email and so then they might be able to respond better.
Right.
As opposed to us just mailing them, because I think sometimes they just get lost, or they're not paying attention that this is an application they should be returning. So I think that if we have emails, maybe, and that's what Laurie added to all of the permits now, so she updated the permits, so we have emails for trying to collect them for everybody, so
Yep.
just to make it a little bit easier to get our permits out.
That might or might not help.
You know what, they're so used to having people mail them or drop them off that, a lot of them are not understanding when we're asking for our emails, so
There's a reason we do what we do, so
we're just trying to do the best we can, so.
I know you are. I
We
know
thought
you
that
are.
it would maybe expedite things a little bit, but I'm not sure if, like you say, Jim, it may get lost someplace along the line, I don't know.
Yeah.
But we'll try it and see what happens.
We went to online permitting a few years ago.
A lot of places are,
It's not perfect, but
yep,
it's definitely easier because people can apply anytime. They can do it from home. They don't have to
Right.
come in. No more paper. There's a whole bunch of positives to it.
But there's
like I said, it's
also-
not perfect.
yeah.
Yeah.
In other places that I work, they do have the online.
Yeah.
And the people that complain the most are I have a couple of older gentlemen that you really have to help them with it because they just don't understand the computer system. And so, yes, and they, instead of paying with a credit card, they'll come in with a check
Yeah.
because they just don't know how to do the
And they don't wanna pay
payment on the credit card.
4%
Yeah.
fee that comes with it.
Right,
yeah.
so they'll drop off checks to me and stuff, so it's just, I just like, okay, that's fine, I don't have a problem with that, so,
Right.
but yeah, so we have to help them fill out the paper stuff as opposed to doing online stuff, but, no system is gonna be 100%, so.
Right. Yep.
But it works. Do you do open.gov?
OpenGov, yeah.
Yeah, that's what they have too, yeah, everybody seems to be going to that route,
Yeah.
but it has its quirks.
Yeah, for sure. We started with it many, many years ago. It was supposed to be not only permitting, but inspections, and it never worked as an inspection software, so.
It's really hard to put things in there for inspections, I
Yeah.
find. But I first used it when I was in Haverhill, and they had it there. And again, people come in and don't always understand what the process is, but yeah, that was the first place that I
We've
saw
had a
it.
few people that, mostly older gentlemen. I don't have an email, I don't have
Right.
computer, I'm not
Yep.
doing this.
Yep. The same thing, or how to do it on their phone.
Phone, yeah.
Yes, yep. No, so we do have people that have to kind of take their hand to take them through it, or, like I said, sometimes I just give them a paper one and just go, here, just fill this out, and, and then we can enter it into the
Right.
you know, computer ourselves, so,
Right.
but, yeah.
Yep,
Thank you,
All right.
Rosemary.
thank you.
You're welcome.
Nita, you're up.
For the record, Anita Wright, Public Health Nurse for the town of Groveland. I have a brief report tonight. Since the last meeting, the Maven Infectious Disease Surveillance and Case Report Managements have been very, very mild, and they are all up to date. We have no outstanding reports due. We received word that the acute respiratory dashboard is going to be taking a little brief hiatus. It'll be monitored internally very carefully, but they're looking for the weekly report won't happen again until around August. And the same thing true of the immunization dashboard. Until they start giving vaccines, there's really nothing to count. So there is just this little brief, maybe about a month and a half hiatus that we won't have visualization of the activities in the state and nationally. But it will come back, and it will be relevant. In general, it's been a very slow 2 months, but I'm expecting the summer wave of Omicron cases and enteric illnesses that tick up usually seasonally to start coming in drips and drabs. The subvariants that are driving the COVID presently in the world or in the United States, in our area, is the KP.3. And the newest one that we're going to be watching for will be the LB1 that's running through California right now
Right.
with the travel back and forth.
Yep.
So right now it's quiet, but it should uptick again. We are monitoring, and I emphasize monitoring, local, national, and global cases of H5N1, the avian flu, both in terms of impacts on animals locally and just human cases nationally and internationally. There's great global interest in that right now. Worldwide, there are 1,000 human cases in 83 countries with 500 deaths, which is a 550% mortality. So it's a serious thing. What I'm asking the board tonight, what I'd like to do is we have a considerable increase, I believe, at least in my neighborhood, in hobby farms, hobby chickens and turkeys and things like that, which is perfectly fine. But what I'd like to do is put on our website, the Board of Health website, I've made copies of, if you're a hobbyist or you have work with animals or poultry or cows or whatever, there's a nice illustrated brochure on what to look for, what to be careful about and stuff like that, both in English and Spanish from the CDC. And I'd like to make that available to the public if they want it. So
Yeah, I'm
I
fine
just
with
want to
that.
put it on the website and say, come to the Board of Health and you could get a copy of this if you need it,
I'm fine with
just to
that.
stay healthy.
Yeah,
That's okay
I'm
with you
fine with
guys?
that.
Okay.
Please.
Travel season, of course, is upon us. Some of us have already started. I want to encourage people to be sure that their immunizations are up to date, use bug spray, netting, and wear appropriate clothing for the appropriate outdoor activities. There is a big uptick in dengue fever in Florida, in the tropics, particularly Puerto Rico. Zika is on the rise again in Florida. And don't eat any armadillo meat in Florida. Leprosy is on the rise. My collaboration with the Board of Health, the Ask a Nurse event that I have with them is doing very nicely, and we're likely to expand that before the end of the year. And I'm pleased to say that we've been working closely with Rite Aid. I'm waiting for confirmation of 2 dates, but we should be able to produce two flu clinics this year. They've dropped that cost that was, the outlay cost is gone. Now they're down to charging insurance, and then if you don't provide 20 people an hour, if there's an overload of pharmacists, it's $100 an hour for every pharmacist that isn't working. So Lori and I talked about if we did have a little issue like that, would our budget be able to absorb a couple $100 in that? And she felt, given that the rate we use our general funds carefully, that we should be able to provide coverage for any overage. The other thing would be if somebody came in and didn't have any insurance, I would be very hard pressed to turn them away.
Yeah,
And
I
and if
agree.
we had to pay for a vaccine dose, it would come out of our general budget, which is, would be under about $59.
Yeah.
if that's agreeable to you guys.
Yeah, no, I agree. I wouldn't turn anybody away.
Okay, we don't usually have that issue, but you never know nowadays.
Yeah. What are we looking at a timeline for, like, the length of the clinic? 2 hours, 2.5 hours?
3 hours
3 hours?
for 2 dates, 1 week,
Okay.
1 week apart.
So 6 hours total.
Right.
Yeah.
I've secured all 4 of the possible dates. The chief has been good enough to block out for me, Fire Chief Valentin, and he has offered assistance of his guys on those dates as well. So we should be, I'm just, again, waiting for Ms. Fontaine at Rite Aid to get back to me and confirm the dates are good with them and with us. And then the Board of Health, the Council on Aging will be responsible for the signups, the pre-registration. They have like a website that they give
Yeah.
you, that you could click on.
That the color
Registration.
platform?
I'm not sure what it is. I don't ask. The registration and health questionnaire. They will also be doing that on scene, but most of the pre-signups we would like to have done. And Nisha will be handling that. And I think that should do it. We're hoping for, between the 2 days, 150 seniors participating.
So, seniors only, or are you going to do
Yes.
18 and up?
No, it's associated with the Council on Aging, so it would be 60 and up.
Okay. Do we have I know you don't want to give the dates because they're tentative at this point.
Your
but
October dates.
October dates, okay.
Yeah,
perfect.
so
Not-
the marketing
Not too
and
early,
the,
not too late.
the marketing and the advertising for that will be both, phone reminding people. It'll be in the newsletter and
Board out front.
it'll
once
be
it's
everywhere.
time.
Yeah, so I'll be looking for that, and Nisha will be largely responsible for that. She's, and Alyssa is pretty good at getting the word out.
All right,
Can you
perfect.
handle more than 150 if they come?
Yeah, sure.
Cool.
Yeah, but given the recent history, 75 is. it
What's
would
with
be
the
great.
average? So
Huh?
that's the average, so you doubled
Yeah.
it.
I mean, I couldn't even get to 50
Thank you, Anita.
this year, so
I'm only 56, you're going to turn me away?
I might, depends. No, you'll be fine.
Sorry.
So the other thing that may influence this, we may be giving COVID at the same time. They're working on a COVID flu vaccine
Yeah.
combo, so I don't know exactly what the material will be, but we'll be ready to give it out.
Right. Okay.
So, and that's all I've got. Any questions?
I don't have any
Concerns?
questions.
No, thank you.
Good. Okay, thank you.
Thank you.
Does anybody have any new items or anything that needs to come up in a meeting, or? Um, No, I don't have anything. So if there's nothing else, I'll entertain a motion to adjourn.
I'd like to make a motion to adjourn the meeting, because we took care of business pretty quickly tonight.
Do I have a second?
I'll second that.
All in favor?
Aye.
Aye. Motion passes 3-0.
He can go home early.
Adjourned.